Oh, C4.
Felix, are you on the phone?
Oh, hold on.
You're muted maybe. Hold on.
Unmuted.
Anyone there on the phone?
This is Felix.
We guessed it was you. You come up as Assembly
Yes,
Seat
what's
4.
I can sense his presence.
Or as Meg says, she feels a disturbance in the force. Oh, she didn't quite say that. She said something else. She said she can feel your presence. Anyhow, are we recording?
Yeah. And
We are live. Good morning, everybody. Welcome. Today is January 17, 2025. We're here for a work session on AO 2025-17, an ordinance of the Anchorage Assembly submitting to the qualified voters of the municipality of Anchorage a ballot proposition amending the home rule charter to require a single application for all municipal benefits and assistance programs, and AO 2025-18, an ordinance of the Anchorage Assembly submitting to the qualified voters of the municipality of Anchorage a ballot proposition amending the home rule charter to update charter text with corrections for grammar and legal rulings and ensure efficient government. We are on the schedule today. We're noticed from 10:40 a.m. to 11:40. It is now 10:41. We'll start with introductions. Mr. Littlefield.
Mark Littlefield.
Karen Bronga.
Anna Brawley. Meg Salato.
Christopher Constant on the phone. Mr. Rivera.
Present.
Thank you. Anyone else? And with the administration, we have
Barbara Jones, Deputy Chief of Staff.
Brendan Babb, Chief Innovation Officer, I-Team Director.
all right. Thank you. So we'll let Ms. Zalatos kick us off.
Great, thank you, Mr. Chair. So both of these are before us on Tuesday night. So I'm going to start with the procedure of what I hope will happen and then tell you why I put both of them forward. So my intention with the universal application for benefits is to move to postpone this item indefinitely. You will also see for introduction on Tuesday night an ordinance that does this through code. So I want to talk a little bit more about that substantively in just a minute. The other one, which is the corrections for grammar and legal rulings with regard to the charter. I prepared this in conjunction with a solicitation from the municipal attorney's office to some departments and assembly legal counsel to see what needs to be cleaned up in the charter. There's quite a bit. So my intention for this one Tuesday night is to do a formal referral over to the Quality Municipal Services Committee to look at this as a bit of a to-do list. And figure out what are the best ways to tackle this. There's a number of cleanups in here. So what options exist and what options might make the most sense for the various cleanups and changes in that. So neither of these is intended to be voted on Tuesday night, except for procedurally how we may want to handle them. What Matthew is handing out is the ordinance on universal services that we are introducing for Tuesday night. So we won't be voting on it, but it'll be introduced and then set for public hearing. The intention for universal services application really comes from a place of where we're seeing a number of government programs go at the state and federal level, which is how do we create efficiency by screening folks for what they might be eligible for instead of having folks who need assistance are eligible for assistance being an expert in every possible program that could exist. The code itself, the code change proposed is pretty minor, other than it creates a new section in code, and it really leaves it to the administration to figure out the best way to get there. I did a little bit of informal polling from the health department and public transit primarily as the first two places that came to mind, and I found maybe about 8 total applications that could be combined into a single form, depending on how that was implemented. And then I also inquired with fire. They didn't have anything directly, but frankly, I'm not even an expert in every municipal benefit that might be available in the municipality, let alone how our residents might be. So that's the intention. That's how I hope to see us move through these items. And really wanted to, at the chair's urging, because 2 of them were proposed charter changes, wanted to tell you what the intention was, set aside this time. So at Tuesday night, we weren't scrambling and worrying about whether or not we were putting something on the ballot, perhaps, and then also because I didn't expect to take the full time, opening up the opportunity to talk about what a unified or universal application might look like. There would be time between now and a public hearing, obviously, to get ideas, make an S or whatever might be in the mix. So have done some outreach, just so you all know, with the Alaska Black Caucus, Disability Law Center of Alaska, former Department of Behavioral Health, or the Division of Behavioral Health lead, and then really digging in deep to how the state has consolidated these applications on the public benefits side. And then there is an organization called Recode America, which is all about how to really start to take government action and implement it in a way that funnels it down so that it is the most user-friendly for residents. That's it, Mr. Chair.
All right, when at 10:44, we were joined by Mr. Salt on the phone. And anyone have questions for Ms. Alto? Go ahead, Ms. Bronca.
So you might be getting to the point, but I'm not sure why the code change is needed for the universal. I haven't read this, so if you're getting to that point where you explain why, then I'll just hold off. Otherwise, I'm trying to understand why that needs to happen.
So a code change isn't necessary unless we want to require it, right? The administration could decide that this is the way they want to implement these on their own. I think requiring it is to ensure then that new programs that come in have to be directed and funneled into a universal application. Ultimately, and this is where the charter idea came from first, is it'd be really cool if it was in our Bill of Rights as residents of the community, I think. I think it's very protective of our residents, really showing we want to be proactive in assisting them. But that's a tomorrow question as they take up the broader charter changes. But I think we can start with it in code, see how it works. The proposed implementation date for the code change is January 1, 2026. So it does give quite a long runway to figure out what might work. And in the in-between time, I plan to meet with Brendan. We hadn't had a chance to meet yet and say, okay, logistically, how do you feel about that date? You know, what else might we need to tweak?
I think I would answer also, there's one other reality is that a change in administrations could change the intention. And if it's in the code, it's much harder to break. And so we have seen a number of, even just an email list inside of this building, the previous administration broke it because they didn't want to have that tool. And it's taken some great effort for a new administration to fix that. We wouldn't obviously want to put email lists in the code, but generally speaking, one other protective factor is if it's in the code, it's the law, not just a strongly worded letter. Go ahead.
If you insisted that there was no funding, or the muni wouldn't work with organizations that weren't part of this universal, would it do the same thing? Or you still feel like, you know, if you are an organization that goes for grants through the municipal health department and you were required to be part of this universal, if you were going to receive any grant funding, could it do the same thing, or you still feel like it would be at the whims of different administrations?
No, I think the way the code is proposed, it says to the greatest extent possible, ease the public's access to benefits and programs. And so these would be municipal programs. And so whether or not that extended to third party or grantee implementation would be an open question for the administration, what would or wouldn't work. Not all programs require applications and eligibility, but a lot that we do here in the municipality do, like reduce bus pass fares or childcare assistance or those types of things.
I would add to that it's just unfeasible to contemplate a universal application for third-party services through the municipality. For example, the place I work in my day job has a very complicated and complex application process that includes a visit by a skilled healthcare professional who can make a diagnosis. Couldn't happen within our system. So I think, just to be really clear, we're talking about municipal services. I say it's her proposal, I'm sorry, but I kind of want to make sure it's clear. It's not for parties doing business in the muni, it's for the muni business. And I would note also at 10:48, Mr. Johnson joined us. Ms. Brawley.
Yeah, actually, so I see Director Rash in the back. I had some questions, not for a position on this idea so much, but I think it'd be helpful to understand for those applications that run through the health department, like WIC or some of those other ones. I'm just curious, what that looks like, and then kind of what the, starting to understand the current staff time associated with that. Cause I think part of this idea is that it's more efficient. And I see, Ms. Jones wanted to speak.
Ms. Jones.
I know, sorry. I know you didn't ask for the administration's position, but we do have a position and we do have staff here that can answer your direct questions. So I just wanted to jump in and see what you'd like first.
Yeah, actually, that'd be great. Okay, I just didn't want to put Kim on the spot, but yeah, if you would like to speak to that and then answer some questions about how it works now, that'd be great.
Well, we're here because good government is one of Mayor LaFrance's priorities. And the administration is actually excited about this proposal and streamlining the application processes to make it easier for citizens to apply. We're particularly excited to leverage the innovation team, which is why Brendan Babb is here. And we'd like to talk about possibly a pilot project or something like that. But I think those details really need to be left to Brendan and his team. We want to make sure that we have the time, the resources, department input to make sure that we can do it right. But we're happy to be here. We want to hear from members. And of course, we've brought people so that you can ask those questions. And the concept is we want to make sure that it's possible in the current departments so that we can streamline the process going forward. So thank you.
So Ms. Rash, I think I'm going to invite you up to the table. And would note for the record, 10:52, Mr. Martinez joined us. And the chair had to step out for just a minute. So if you're on the phone and have a question, please let me know. Ms. Rash?
Kimberly Rash, Anchorage Health Department. So currently right now, if you were to go to our webpage at muni.org, you would see a bunch of different programs. You then have to click within those links to access the applications. We have 2 external websites that are connected to our Muni webpage, which then takes you to another webpage where that application exists. And with the help of IT, some of those applications are currently a form stack, meaning that the participant can complete the application and then it gets sent to us. And then we have to do processing on the back end. One of the pieces that, we're still looking at is if it's not a complete application, we then have to try to engage with the applicant and or the applicant then sends in information, and then we then have to try to connect the application with the documents. Some of those documents can be birth certificates, social security cards. They can be, applications for rental assistance. So it could be a lease. It could be utility bills. So there's a whole plethora of different documents that are attached to applications. A lot of our applications are also governed by the state because we do receive obviously state benefits. And so a lot of those forms are quite regulated. But we are excited, as Barb had mentioned, that really if there is a way that we can streamline, because oftentimes it's not very clear what benefits that we do offer and what do require an application versus just maybe a phone call to the health department, and who do you call for such benefits?
So I guess so I'm aware at the state level, and you're right there, and there's a lot of processing that happens there, Medicaid, SNAP, right? These other ones. Maybe just clarify, are those are ones that are only done at the state, or like for something like SNAP benefits, is that something the Muni does for residents within the municipality?
For SNAP benefits and things like that, that is at the state level. So the benefits that we are offering, like WIC benefits, childcare licensing, shelter applications. So not all benefits that a person within the municipality could be eligible for does run through the health department. And so if that's the case, then we have to direct them to the state application to fill out that application. And so, yes, it can get sort of confusing what we offer at the Muni and then what the state may offer.
Thanks. And just one more question. Yeah, and I think that could be obviously clarified through communication as well. I mean, that's the benefit of this process. My other question is, I guess, it's always helpful to frame things as what problem we're trying to solve, right? So I think the problem here is it's inefficient for the person. There's probably inefficiency on our end. And then we're not maximizing people's ability to access things that they are entitled to, essentially benefits that are out there. My question is, are there any, so are there any prohibitions right now, or are there barriers for, say, staff? So hypothetically, is someone walks into the office, they're looking for WIC benefits or some specific thing. Are staff currently empowered to run through it, eligibility of these other programs, or is it really just, okay, you asked about this one thing, right? And then is there any prohibition on doing that, right? Like, is there any current rules around that you know, if you asked for A, you can't also look at B?
Great question. So absolutely, there is no prohibition against that. And that is something that we are striving for. As we are all aware, we've had in the past high turnover. And so really trying to, what our vision at the health department is to have someone come in and be offered the plethora of benefits that we offer, because we know that if someone's coming in for clinical services, perhaps they need additional WIC benefits, or if you have a disabled individual, connecting them to ADRC. And so we just have not gotten to that point. But I think that, you know, as we continue to train staff, as we continue to break down any internal silos of understanding of what other programs exist within the health department, that's definitely something that we're gearing up to keep on moving forward with.
I think though that there might be some affirmative permission needed, right? To automatically enroll people in all the programs. You might actually create some offense to some people.
Yes, correct. Each of those applications do require authorization, and we would not just automatically enter in an individual to a service. It's really making that warm handoff and those connections is really what I was hoping to convey, is
Yeah,
that
so
we
they do
don't
it once,
automatically.
and then it's automatically in, but then they have to affirm, yes, I would like this, because I could imagine stigma and other things attaching to certain processes. We'll get Mr. Salt and then Ms. Alatal.
Thank you, Chair. This is a question for the sponsor. I'm in favor of this. I think it's a good idea. I'm surprised we haven't done it before. I'm sure other municipalities have done so, but what's the negative? Is there a negative to this? I haven't been able to think of one, but just curious. Thank you.
Well, in my opinion, there isn't, but there could be for the administration in trying to implement it. I would just highlight, if you go to the Division of Public Assistance for the state, you can really see how they're starting to winnow down the number of applications. So they haven't gotten it to a single one, but they certainly have winnowed it down into some buckets. I think, to me, I'm going to flip your question on its head. I think the biggest benefit is that it is hard to be an expert in every possible benefit you could be eligible for. And so if there's some initial way to screen that you might likely be eligible for this thing, so you don't have residents running down rabbit holes and encountering frustration by applying for the wrong thing, that can then result in maybe not having the wherewithal to apply for the right thing. It's my opinion that if we offer benefits and we have money to offer benefits, we need to make sure we figure out how to best and most efficiently connect those benefits to the people who are eligible for them.
I heard some whispering over here on the question of, are there any harms? Does the administration want to take a stab?
Through the chair. One challenge is just PPI, just making sure that we're securing information. Also for a form, often for applications, there's required fields that we need to apply. And you might want to set that up so that if you're applying for one thing, you don't have to enter everything for like animal control or you know, if you're for a residential property exemption, you have to send in your driver's license. So I think the intent is fantastic and we're very excited about it. I think possibly a pre-screener or telling people what they're eligible for and then following up might be a better approach than one universal form, so that if you're just trying to get one thing, you don't have to fill out all the other stuff that might be required for a different program, but that you could be notified that you are eligible for a program or steered from the website. I mean, ideally what you want to do is, should we have a form to apply for this? Should we just make people eligible? Then you want to see, do we need all these fields? are we asking people for information we don't need? And then just try to minimize from that. So I think there's opportunities for policy changes as well to minimize, like, do we need this? Are we using a fax anymore? Do we need this fax number? Is this required? So I think there's an opportunity to really look at the forms that we control. To what Director Rash said, some of the stuff is defined at the state or federal level, so we don't have a lot of control there. But I think the goal is to remove friction and make it easy for people to apply, both on the resident side, and simpler forms are easier on the employee side, as well, on the muni side as well. One project we've worked on is senior property exemptions, and sending out letters with property appraisal saying, hey, we noticed, I originally wanted to send it on their birthday. My staff told me that was a little too creepy. But you have a residential exemption, you've turned 65, there's pretty much a 95% chance you're eligible for the senior exemption. So we work with property appraisal and send out a letter, and we pre-fill in the parcel number, because I don't know my parcel number off the top of my head, but trying to make simple things so that people keep moving forward. And I think there's a lot of work on behavioral insights, and a lot of other cities. Seattle has something, Civiform. They work with google.org to try to have it memorize some of the form stuff that you have to fill out a lot. They haven't dealt with PPI, which is always just a challenge, and you want to be really privacy and security. Also, as Chairman Constant mentioned, there are some requirements. Some benefits make you not eligible for other benefits. You just need to be careful of unintended consequences. That's probably a way longer answer than you wanted.
So, and I would offer that there is one muni example that's a perfect example of what you don't want to do, and that's what HR has done with job applications, which screening can become so fierce that people can't even get their applications considered, and department heads are like, why aren't I getting any applicants? And it's actually a function of the system, not the function of applicants. And so that's one. But I would also offer, it sounds like you're talking about at a higher level than just benefits, like social benefits, a parallel to the My Alaska system, which is an enrollment into a database for the muni that then ports you into a variety of other opportunities. I can manage the grants at my day job. I can apply for my PFD. I can renew my business license. I can do all of those things in My Alaska. And so in a way, it feels like we're talking about something that has a cognate that exists pretty well in the state.
I think is a great idea. That is a much bigger project, and having the IT representative here, I don't want to throw him under the bus during this, but that would probably require a lot more scoping in terms of item management. But
I bet SAP could do it.
I think there's opportunities to do pre-screeners. A lot of other cities and other organizations have done that to let people know that they might qualify for this other thing. Also, reciprocity is a big feature. If you qualify for SNAP, then that means you qualify for other programs, and you don't have to reprove your income and assets. So that makes things a lot easier amongst federal programs and some state programs as well, as if you're already qualified for one. That makes things easier. And I, for one, Alaska, like, I don't want to leave any money on the table. There's federal dollars out there. We can have debates on whether we have a program or not, but if that's our law, we should make it as easy as possible for people to get the benefits that they qualify for.
Okay, so Ms. Zalatoa, then Ms. Brawley.
Yeah, thank you. So I've gone down the rabbit hole of how the division of, or the Department of Public Assistance has done it at the state level. And what I really like there is it is somewhat, it's a screen. Sometimes your first application is enough to say that, you're very likely eligible. What I really like is they have a portal for you to upload your backup document, your proof of things. So you don't have to wait for someone to reach out to you, which creates great government efficiency. And that's actually really sped up at the state level, the manner, right? They have everything when they then have you in that electronic queue. It doesn't mean you have to preemptively or proactively upload your stuff. You can still get the request and respond to the request. And those applications, they sometimes have where they will get some of your information and say, okay, in order for us to now, like, yes, it appears you're eligible, but in order for us to comply with our federal reporting requirements, we need you to provide this additional information. But it's after you're already likely for the thing. You have you have an interest in doing so versus just having to fill out lengthy application after lengthy application after lengthy application. There's a lot of fatigue associated with having to seek benefits over and over and over again. And maybe I know there are some programs, if you don't happen to file the right application, it's not like, oh, well, you should have done this one. Let us port your information. It's sorry, you're denied. Art stop. I will be at the MLK Legal Clinic on Monday. I will literally be reviewing people's mails about public benefits they were not able to access and denials, and most of it's procedural. And it's been the same for about 18 years now. And so this really is something that we could proactively do. And how it looks in the end is something I am not wed to. I think it is left to the administration and the departments to work collaboratively to figure out what the right product is for residents. But I think this is a great way to advance two goals that often aren't spoken about in the same breath, which are equity and efficiency. And I think that you can do this pretty substantially with something like this. Thank you, Mr. Chair.
Ms. Brother.
Thanks. Yeah, I think, well, one, I just want to note, in terms of the upsides of streamlining this is a lot of these programs are long-term cost savers. So food is one of the most cost-efficient things we can invest in for people that has big benefits, right? Or Medicaid, literally the more people who have any kind of insurance, the less uncompensated care we have. And that's what partly what drives up our costs. So just to say that. My question is, from AHD's perspective, kind of what is the most, I guess, rigorous, or so I'm thinking in terms of kind of intensity of time that it takes to work through the application, probably for the applicant and the staff. What is the most like onerous application? You know, is it the WIC program, or, you know, I imagine it's probably one of the federal ones versus, like you said, there's things where you just make a call and then somebody's, oh yeah, you can come in and get a flu shot or whatever it is. But I'm just thinking about that, like what is going to be kind of the hardest thing for folks to work through, do you think, or what is it now essentially?
I think it's a bit hard to say. And I only say that because a lot of times what we encounter are language barriers. And so, in trying to assist an applicant in that process. But I would probably say the longest types of application is going to be through ADRC, through WIC. When you get into our environmental health team, when you apply for a health permit, sometimes those can be a little bit daunting. There are a lot of information, and I think there needs to be, is the person applying individually, or is it an actual entity that's applying? So like childcare licensing, or applying for a health permit for your restaurant. Or your barbershop. So two very different things. And so kind of looking at that aspect is going to be important as well. But I would probably say those three would be the longest ones that we have.
Thanks. And I have a follow-up question too. I know there is also a lot of conversation about more the business side, I think, like making that system easier. I guess I'm seeing this as a separate effort from that, but I hear your point that it's hard to to move through these processes generally. The other question is, what would, and maybe for the sponsor as well, what would redetermination look like? What is the cycle at which these need to be reviewed? Because I think we saw at the state level, there was a trigger, I think it was federal, to say, or no, maybe it was state, that you had to recertify everybody, and that's caused a lot of kind of churn. And also, I think it's not appropriate to just give somebody a card for 10 years and then not check in with them again, because people's circumstances change, right? To the point about becoming a senior or other, maybe you are a student and then you get a job, and so you're not eligible for some of these benefits. So what is a reasonable time frame by which these need to be renewed?
For some of our benefits, I would say it ranges between 6 months and a year.
6 months to a year renewal?
It depends on the program and what benefits you apply for. So it could either be
Every 6 months, not.
Or
Oh, that's, ugh. That sounds like bureaucracy at its finest. Okay, others? Anyone else? Go ahead, Brendan.
Yeah, I mean, 6 months, some of them are federal in terms of having to recertify. I would be curious, I'm curious what would make a good pilot, or potentially what, as the sponsor, what the sponsors have been thinking about that might be something that would be helpful, or 2 or 3 things that could be something that lessons learned could occur from, or a pilot that would be impactful, but also not too simple where we don't discover anything, but not too complicated where it just derails stuff to some extent.
Yeah, thank you for the question. And it really is where my inquiry to public transit and public health went, which were often disability or income-based benefits. That was where my mind initially went. There are many, many more applications for things in the municipality, whether that's a licensure or something, but I was much more in that needs-based or status-based benefit, I guess I would call it. And I could see, for me, a pilot would be one where hopefully we don't just sit in a department, because I think that that's a tiny bit artificial. I think combining what the health department does would be very efficient and very good, but adding an element from one other department, which is probably the intersection of something just outside, like a lot of the money that comes into public transit is federal. And so they might just have a tiny tweak on the requirements versus state pass-through grants that we administer out as benefits. So just thinking with a little bit of that lens, but not necessarily everyone that might be there. I think a pilot is a great opportunity to get good learnings. I also think a pilot can be structured where it honestly has likely the most impact. Are we seeing an increase in utilization? Are we seeing an increase in resident satisfaction? And are we seeing an increase in satisfaction from the departments that this is easier? Thanks.
Just one response to that. We are seeing programs that are, Alaska is going to be one of 25 states that can use IRS Direct File, which is a free tax filing service. And one thing they're rolling out this year is sharing some of the W-2 information into the application. We were supposed to be in it last year, but PFDs made it too complicated. And it won't be quite as good, because if you have a child with a PFD, you can't really use it. That's going to be a challenge. But having that information pre-populated makes things easier. Data sharing agreements are something I'm interested in. I'm not sure at the federal level how you do that with transit and health, but if it's possible to do it at a lower level, then maybe it's like, you already qualify for this health thing. We just need you to fill out 2 other things to qualify for the transit thing. So I'm not sure, the devil's in the details on that, but something like that might be a possibility. But I defer to Director Rash on if that seems possible.
I don't know exactly, but I think in concept it would be great if we could get as much information as we could, because we also know a lot of times when individuals come to us applying for benefits, they don't necessarily have all the information. They may not have, their tax information. They may not have a birth certificate for a child. So if we can gather that information at the start of the application, it makes it a lot easier for the applicant, it makes it a lot easier for us, and we can start processing things a little bit quicker as well with that.
Karen and then Zach.
I just was in my head trying to picture, so like Member Zolotel said, the little tweak by what public transit might require that is different than their WIC benefits. So I'm just trying to figure, someone's going to have to be like an expert in that's winnowing through this universal application. They're going to have to be pretty expert in all these different organizations, or does the universal application trigger a message to transportation, WIC, saying there's a possibility this person, that it goes to the departments then and they look at it and reach out? Because otherwise I feel like people will have to be experts in lots of different programs to go through it.
Yeah, that's a great question. Ultimately, yes, it would go back to the departments to make the call as to whether or not they were eligible. The idea, though, is to gather the information and get that pushed out to the departments through the least number of times that the person has to fill out that same information.
Zach?
Yeah, thank you. Question for Ms. Jones. You said the administration supports the idea of a single application, which is great. So do I. Kind of like a menu of options here, though, right? There's just AO, there's a small charter amendment, there's part of the bigger charter amendment. Is the administration supportive of any and all of those options, or do you have a more narrow range in terms of what you guys are jumping on board with?
I know that was to Barbara, but I think you missed the first part of the meeting, right?
Oh.
And so why
I
don't you
did.
go ahead and hear from the sponsor first, and then
Okay.
you can tack over there.
Sorry about
Oh,
that.
no problem. Yeah, I went over the procedure first. So it's my intention on the charter amendment to postpone the single application charter amendment, to postpone that indefinitely. On the bigger charter amendment of cleanups, which is the universal application is also included in, it's my intention to formally refer that to the Quality Municipal Services Committee, so that they can take a look at what's the best way to tackle the whole suite of charter amendments. And then this is just for introduction on Tuesday night, because we realized we could do it via code. It won't be set for public hearing until the 11th.
Well, thank you. Sorry for making you repeat yourself.
So now, the administration.
And now, since it seems like it's kind of a moot point, you don't have to jump on it if you want.
Well, but you can hear from them. I mean, you can restate it. We're going to conclude maybe because we're getting close to the end, but the administration's position is,
Yeah, we're excited about it. You can hear the excitement from everybody. We think it would be part of good government. So, but I think, of course, with anything that we do, we want to make sure we do it right. And we want to make sure that we have the resources and the time to make sure that it's done right. And I think Brendan has done a fabulous job describing a pilot, because I think that's exactly what the administration would like, because we want to test it. We want to see if we can break it. We can find the errors for the bigger picture. So we'll just stay tuned and keep in touch and see where this goes.
anyone else? Sponsor, last words?
So the substance of this will really be a conversation for the, excuse me, for the 11th, when the ordinance comes back before us and has public hearing. Thank you.
All right. With that, I think we are going to adjourn this work session. We'll be back at 11:50 for a work session on municipal elections. So we'll see you soon.